DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. We're going to have a familiar face and guest that we enjoy having, Dr. Matt Miesner, here on the show today. We're going to talk about pink eye, something that everybody sees, we talk about a lot. Dr. Miesner is an expert in animal health and well-being, and it's just going to be a great show, so stick around.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
If you're looking for advanced and innovative livestock handling products and facilities, Daniels Manufacturing Company is who you want to choose. They are a family-owned business that puts the needs of their customers first, and have so since they opened in 1958. With low-stress cattle handling being of the utmost importance, they are focused on quality, not quantity. The company prides themselves on prioritizing the animal's well-being by staying on the cutting edge of design and only using the best materials and manufacturing operations. For more information or to purchase your own, contact Daniels Manufacturing Company today. Closed captioning is brought to you by Profusion Drench for beef cattle, a no prescription, no needle supplement. To learn more, go to zenpro.com.
Hey folks, welcome to DocTalk. Look who's back, Dr. Matt Miesner. Dr. Miesner is a clinical professor here at the Livestock Services section, where he is the section head here in the veterinary hospital at Kansas State University's College of Veterinary Medicine. Great to have you back on the show.
Great for you to come back.
Yeah, it's fun to be back in Manhattan. K-State was so good to me and my family, and we have nothing but great memories of working with you and your family, and our kids went to the same high school, so a lot of good things.
Yep. Miss you. Glad to see you.
Feelings mutual. So let's talk about pink eye. You said you're seeing plenty of cases, huh?
Still, yeah, every summer, but and as usual, some operations are having a lot worse problem with it than others, but everybody's getting affected with it at some level. From young calves to bulls to cows, and you got to be able to recognize it and treat it quickly. So I mean, but yeah, it's one of those that year after year. What they discovered this 1960 something, I don't know, what 40, 60, 50 years. So, and it's over and over and over, and it's a really difficult disease to treat, but it's just something that we have to deal with.
So what causes pink eye, or what's kind of the, some of the general principles of what causes it?
So it's easy answer is a bacteria, and the test answer is a Moraxella bovis, but yet we know for sure with all the research that it's a Moraxella bovis. There's a Moraxella bovoculi, there's a mycoplasma, and then all of those might interact with other bacteria to make it go, so those bacteria are the causative maybe organisms, but it's a multifactorial disease. So they usually generally have to have something to give them an entry or a toehold to really cause damage to the cornea. And they may work together too. But so it's a bacteria, but there's a lot of environmental things that go into the disease itself.
When we, it's kind of like respiratory disease. We have a whole bunch of bacterial pathogens or mastitis or scours. I guess, why would we think the eye is going to be any different?
Exactly. And these bacteria, and if you figured, they're trying to survive in a really exposed environment. And what's kind of interesting about these bacteria is they've developed a whole bunch of trickery or ways to avoid getting killed by the environment. And so we see this just over and over as these bugs change and avoid the immune system or antibiotics or whatever we're going to do to treat.
Yep, and so we'll get into the treatments as we go along, but is there any certain type of pasture or any kind of risk factor that we see more or less of, or is it like fescue versus brome versus native grass, or I don't know, probably all across the board, huh?
It is. I mean, but typically the taller grasses, the stuff with more seed heads, or areas that are more dusty, or more sun exposure, any of those and all of those together might be a factor. And they might see more pink eye in a certain part of the property than they do in others.
Yeah. Well, we've seen a bunch of it. It's something we're treating often. So when we come back, we're going to talk about the clinical manifestation of this disease. We're going to talk about some of the treatments and some of the preventions. It's great to have Dr. Miesner here on the show. We'll be right back after these messages.
There's something spreading across cattle herds in the United States. It's estimated to cost operations nearly $1.4 billion every year. It spreads through the environment, from one animal to the next, and even through feed and water. And although it's a disease you already know of, you've never seen it like this. Bovine viral diarrhea, commonly known as BVD, is not new. But over time, the disease itself has mutated. It happens because of the virus's single-minded goal, to survive. By mutating its genetic makeup, BVD evolves into new strains, which is how BVD type 1b came to be. This isn't the first mutation of BVD, and it most likely won't be the last. Before BVD type 2, there was type 1. Now we recognize BVD type 1a and 1b, with the most predominant being type 1b. BVD type 1b can successfully invade the respiratory and reproductive systems of cattle, spreading from heifers to cows, calves, steers, and bulls. Even previously vaccinated cattle may be at risk. Most BVD vaccines aren't labeled to protect against type 1b.
It's time to tune in to Tennessee. That's where the Cattle Industry Convention and NCBA Trade Show will be in 2021. It's the biggest convention just for cattle producers. In Nashville, a city with amazing southern hospitality that's packed with the best food and great music. You can't miss it. So make plans now for CattleCon 2021 at the Gaylord Opryland Resort in Nashville, Tennessee. Tune in to convention.ncba.org for more information.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Matt Miesner. And Dr. Miesner is a clinical professor, and he is the section head of livestock services here at the Veterinary Health Center at Kansas State University. And it's a you ought to come in and see their new facilities. You ought to see the new facilities that they have, the ability to treat your animals, and you're getting cases from all around the country that come here because this guy is dang good at his job. And great facilities, great faculty, great program.
Yep, enjoy being here. Been here a long time.
It's awesome. So let's talk about pink eye and how it manifests, and you know, and what is the progression you see in the clinical signs?
Sure, and it is really easy to pick up. It follows a pattern. Initially, it might be something you just see a tearing eye, but and it could anything at that point. It might be just a scratch, but it generally progresses in a similar fashion. It starts with a watery. It's kind of an irritation. You'll start to see him squinting the eye. The water becomes, the tearing becomes worse. Then you start to see, and sometimes it's pretty sudden onset, the eye will just get cloudy. And then what's the interesting part about pink eye is that it tends to start to focus more on the center of the eye versus an injury or other that might be around the whole eye or on the periphery. The pink eye tends to focus pretty much an ulcer or damage to the clear part or cornea of the eye right in the center. And so it tends to follow that pattern pretty well. And so you can identify it pretty readily.
Yeah, and so, you know, you see all different types of eyes. Does the eye have different reactions to that ulcer and that insult?
Yes, absolutely. And if anybody has ever scratched your cornea, it's an unbelievably painful, irritating injury. And so these things, it's damage to that, and it's just horribly painful. We've even seen it where, and it can be so acute and so severe depending on the pathogen that it can rupture. And so sometimes these corneal ulcers rupture, and you'll see just tissue that's plugging that hole, and really, really damaging. Fortunately, cattle have a really thick cornea, so that doesn't happen all the time, but it's bad.
I suppose if you're head down grazing all day, every day, you probably need to have a pretty thick cornea, because you're going to get stuck with things.
Yeah.
There's
always something trying to whip you in the eye, and that's part of the examination. When we do this, when we see this, we do look for other foreign material in the eye, because it could have started out as a grass on or a sticker or a foreign body that's caused damage to the eye.
Obviously, we're going to talk about treatment, but you know, what about the stage of the disease and treatment efficacy? Is it something that you should let go, or is it something, if you see one, get it treated right away?
I would treat right away, right? So it's going to be progressive. We know the sooner that we can get typically antibiotics or get antibiotics to that area, the better. There's going to be a certain duration or course of disease regardless of the treatment, but it can greatly be shortened if we can get some antibiotics into it quickly, or flush off the cornea, clean it off.
Okay. So folks, understanding that progression, trying to prevent the ulcer of the eye, get them treated soon. So that's what we're going to talk about next. When we come back with Dr. Miesner, we're going to talk about pink eye treatments. You're watching DocTalk. We're glad you joined us.
If you're looking for advanced and innovative livestock handling products and facilities, Daniels Manufacturing Company is who you want to choose. They are a family-owned business that puts the needs of their customers first, and have so since they opened in 1958. With low-stress cattle handling being of the utmost importance, they are focused on quality, not quantity. The company prides themselves on prioritizing the animal's well-being by staying on the cutting edge of design and only using the best materials and manufacturing operations. For more information or to purchase your own, contact Daniels Manufacturing Company today.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. Matt Miesner. We're at Kansas State University, where Dr. Miesner serves as a clinical professor, and he is the head and section head of the Livestock Services section in the Veterinary Health Center at Kansas State University's College of Veterinary Medicine. And we're talking about pink eye, and we've talked about what it is, what it looks like, and you said, we need to treat them soon. So let's get into some of the therapies, some of the things that are okay, and some of the things that aren't okay anymore.
Right. So therapy is going to be multi-directional, I guess. One is trying to get at the bacteria, and fortunately there are antibiotics that are labeled for this treatment. So we would typically pick antibiotics that are labeled for that, so they'll be legal. Then we have some other therapies, which is just cleaning it off, so trying to get this flushed off on the cornea. Topical therapies as well may not be practical in some of these situations, but in some ways, when you have to treat them once anyway, you might as well lavage the eye.
Right.
Pick an antibiotic that's legal, that's labeled, and then start there. We've found now that just about anything that is in the plasma, meaning an injectable or systemic antibiotic, is going to get into the tears, which is then also going to treat the eye. And as this heals, you'll see blood vessels come in, and those blood vessels will help clean up the eye. So systemic antimicrobials and time to healing is about the same as other therapies. There's some more in-depth things that we used to do, which was inject antimicrobials into the white part of the eye, steroids, anti-inflammatories, and those are great for pain control, which is a good idea. But an antimicrobial is going to be first. There are some old things that were illegal, the old furacin or the yellow puffers and those things. Those are actually illegal to use now, some of those furazones.
Right.
So we have to be careful about that. Next, you're treating the environmental influence on it. So shade really helps, and if you get shade, eye patching, sometimes we'll actually just kind of suture the eyelids together, which is really quick. It allows that eye to be protected from the sun and the UV radiation, which is also causing problems, plus the environmental dust and those kind of things. And so antimicrobials, anti-inflammatories, environmental influences, trying to protect the animal from that. And sometimes just as easy as gluing a patch on it. And we always leave the patch open at the bottom so that the tears can come out.
Makes good sense.
Yeah.
That and then are you using absorbable suture?
Yes.
With the eye, so don't go out and use cat gut or something like that. That would cause some irritation maybe if you did it wrong.
Yeah, did it wrong. Yeah, and again, we got to try to stay away from suturing if I can, but sometimes that's the most practical way to get it done, and sometimes you have to take the sutures out. So there's a bunch of different methods out there, and I've got to see a bunch over the years, but we're finding now if you can protect the eye from the sun, UV radiation and the environmental influences and a systemic antimicrobial, you'll be okay. And sometimes, different bugs are going to respond to different antibiotics, so kind of keep tabs on what is working on these treatments.
Yeah, so all those genes that we used to cut up to make pink eye patches.
Yep.
And glue them on. It was working.
Yeah, wrangler pockets are great.
Yeah. Parting thoughts on treatment?
Mainly, I think just trying to keep them comfortable as best we can, cleaning it and providing something. One last thing on treatment: if it's not working, it could be that we try to actually get a culture. Now, remember, these bugs can be multiple in that eye. And they're all working together, and some of these antimicrobials have benefit against some versus others. So mycoplasma, for one, if that's in there, it's going to have a narrower range of antibiotics that'll get it versus the moraxellas that are usually pretty sensitive.
Yep.
So maybe culture at times at that point.
Yep, it'd be good. And I think the other take home as we got to get to commercial is that giving an injection in the neck for pink eye is as good as giving one in the eye.
Right. Yeah.
And that's one that will save you from getting your hands busted and save you from doing more damage than good.
Right.
So, all right, we're going to take a break. We'll be back with Dr. Miesner here after these messages.
It's time to tune in to Tennessee. That's where the Cattle Industry Convention and NCBA Trade Show will be in 2021. It's the biggest convention just for cattle producers. In Nashville, a city with amazing southern hospitality that's packed with the best food and great music. You can't miss it. So make plans now for CattleCon 2021 at the Gaylord Opryland Resort in Nashville, Tennessee. Tune in to convention.ncba.org for more information.
If you're looking for advanced and innovative livestock handling products and facilities, Daniels Manufacturing Company is who you want to choose. They are a family-owned business that puts the needs of their customers first and have so since they opened in 1958. With low-stress cattle handling being of the utmost importance, they are focused on quality, not quantity. The company prides themselves on prioritizing the animal's well-being by staying on the cutting edge of design and only using the best materials and manufacturing operations. For more information or to purchase your own, contact Daniels Manufacturing Company today. ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Matt Miesner, and it's great to have him back on the show and you know, to take a break from his busy schedule to come up here has just been very, very good. And he is the section head of veterinary livestock services here at Kansas State University's Veterinary Health Center, and he's also a clinical professor, somebody that I would trust any of my animals with. So if you have something going on, he's a great one to get a hold of. But let's talk about pink eye prevention. What are some of the things that you're recommending?
Environmental influences, possibly vaccines, okay? So let's talk about vaccines a little bit.
Yep.
They're out there, and again, what we've seen, again, there's multiple different bugs that can be affecting the eye. The vaccines might be not effective against whatever bugs you have in your certain outbreak or your certain disease. There are some opportunities to get a culture and make your own vaccine. But we just have to realize that these bacteria have spent years avoiding getting killed, right?
Yeah.
You know, and so even in the middle of an outbreak, they can actually change their genome enough to not be affected, or not have the vaccines just aren't effective against them. It's amazing. They're just an amazing little bugs. They're always working to avoid that. So vaccines are out there, and what we've typically found is that if your vaccine is not working, it's probably it may or may not be cost effective for you to use it. But you know, try them, change, maybe work with just keep numbers, you know, and see if it's working. Biggest things are environmental influences. So you know, some pastures, if you're having big problems and there's really tall grass, it may be, if it's practical for you to knock it down a bit. So get some of it shortened down, get rid of the seed heads, dust. Are big factors. So if we can, you know, keep some areas kind of moist. Again, UV radiation is another one. So some shades, you know, you'll see that. Flies, you know, flies are big. So ear tags, things that are going to keep them from landing on that. So fly control, any sort of damaging plants and those kind of things that can cause scratches to the eye. Other things. I mean, it doesn't have to be necessarily seed heads. We've seen some pretty brushy areas. You know, they're going through and they're constantly getting scratches on that. You know, keeping areas manure that are going to breed lots of flies. You know, trying to keep that stuff down. Just fly concentration, fly repellent, UV radiation, any sort of damaging plants.
We've seen some of these pastures that, you know, you graze one down and you move cattle into the next one. You have short grass over here. There hadn't been anything grazed over here, and you turn them right in.
Yeah.
And there's not just seed heads, but there's pollen, and those cattle just walk into a dust, and it's just overwhelming.
Right. The right sunrise, you can just watch it, just kind of big puffers as they're walking through that stuff.
Yeah. So it really gets back to that common sense. Anything that you see that could be causing damage to that cornea, try to help those cattle and prevent it.
Yeah, try to get it out of their face as best you can. And again, some things are gonna work, but I think it's the biggest thing. I've got to where now it's just writing down things, because and then you can see patterns. So if you know this is going to be a problem pasture, why is it? Try to prevent it before you get into it. Go from there.
Well, appreciate you being on the show. Great information as always.
Yeah, I'm happy to be here. I really enjoy it.
Thanks, folks. Thanks for watching DocTalk. And if you want to know more about what we do, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. And I'm Dr. Dan Thompson here with Dr. Matt Miesner from Kansas State University, and we'll see you down the road.
Closed captioning is brought to you by Profusion Drench for beef cattle, a no prescription, no needle supplement. To learn more, go to zenpro.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.